Good morning, everyone. In week 5, the specialty population that I focus on was end of life care. The article that I read and wrote about posed the question: Is social work prepared for diversity in hospice and palliative care? While we are trained and expected to be culturally competent, there are some areas in end of life care that provide barriers to us providing effective treatment to some of our patients and families based on the fluidity of what culture and diversity actually means. End of life care is a term used to describe the support and medical care given during the time surrounding death. One of the misconceptions is that EOL is just for patients who are at the brink of death. Um, Sometimes patients live for weeks and sometimes months with a chronic illness. People who are dying, they generally need care. They generally need care in areas of physical comfort, emotional and mental support, as well as practical needs, as well as spiritual needs. The family is also considered an EOL as well. They need support and they need assistance with practical tasks and a lot of focus on their psychosocial needs as well, because they are not um, excluded from emotional distress. Some interesting facts that I found is that studies have shown that approximately 80% of Americans would prefer to die at home if possible. Despite this, 60% of Americans die in acute care hospitals, 20% in nursing homes, and 20% at home. So, what is palliative care? Palliative care is an interdisciplinary care model that focuses on comprehensive management of physical, psychological, and existential distress. It is defined as the act of total care of patients whose disease is not responsive to curative treatment. Palliative care is a form of EOL. It is designed to manage the patient's needs holistically. Um, it doesn't always have to be based upon medication and just soothing pain. Palliative care actually aims to improve the patient's quality of life by affirming it, rather, and making dying as a normal process. And so it's really important to incorporate culture in this form of palliative care. So the EOL team may include nurses, volunteers, physicians, counselors, social workers, spiritual and bereavement counselors, hospice aides, therapists, and nurses. And in the center of all of that is the patient and family. So, how is working with this specialty population different from others? So, there are many options that a patient and family can choose when they are nearing death. When the individual, or the patient rather, chooses end of life care, they are actually choosing to be the captain of their own ship. They are choosing to take charge in their quality of life. The difference in this population is that palliative care, again, it affirms life and regards dying as a normal process. So there are some barriers and challenges in working with this specialty population. As a social worker, it is important to be culturally competent when providing EOL care. Cultural background influences how patients make pain and palliative care decisions. So there are some disparities in when dealing with culturally diverse populations, particularly in the management of pain at the end of life care. There are lots of different cultures who regard pain as a part of the process. There are some, particularly African Americans, who are not fond of pain. So, knowing this, you have to be culturally competent when making decisions and providing the best practices for your family and the client. So, two main challenges are there. there is actually underutilization of palliative care in culturally diverse communities. There's not enough information or resources or support for end of life care. So, cultural diversity and difference has limited definitions regarding EOL. This begs the question, are social workers prepared for diversity in EOL care? Sorry. Diversity is really not limited to race, culture, or beliefs. Oftentimes we think about just black, white, Asian, we think about race, we think about sex and gender. But right now, culture and diversity is so fluid and is ever changing. It is not something that is and will stay the same. So, this is why it's particularly important for social workers to be prepared when working with someone who is outside of their cultural specifics. So, how would myself as a social worker, how would me as a social worker working with this group prepare to address such challenges and needs? Well, the first thing is understanding, as I mentioned before, is that there is fluidity in understanding what diversity and culture means. Um, it is not just based upon gender, sex, race. There is also people who are in prison that you have to consider, people who um, do not see life the same way that you do. So, this requires continuous education and also researching current and future trends regarding the needs of diverse EOL patients and families. So, one of the things that I appreciated was the recommendation by one of my peers under week's 5 topics. So, the recommendation that my peer gave me is upon assignment of a diverse case, have shotgun information there, literature handy, so that you can always refer to it, so that you can be cognizant and not ignorant to what the family may need. And in addition to this, I thought this was really good that you should interview the family members to kind of find out what specifics they value in their culture, what their wishes are, and what their needs are. Having a very intimate interview with the family, I think, will help to provide the best service and the best outcomes and the best care for the patient and their family. What resources are needed as a social worker? So again, because there is an interdependent and overlapping nature of cultural dimensions regarding the impact of EOL service on social workers are in need of continuing education and training, specialization and certification programs, engagement and research, appropriate use of supervision and community experts, and support from all available resources is needed to keep up with the demands of this field work. The resources that the clients, patients, and family need, um, despite the large number of patients that want to die at home, there's not enough information or support. So, more often than necessary, patients die in hospitals due to over medication and infection. So, because of this, I feel like medical social workers should be equipped with EOL knowledge to provide patients with choices while they are in the hospital or if they are in the presence of them. I think that the resources that they need are to be advised on what EOL can potentially offer them, not just on a medical level, but a spiritual and emotional level, and just kind of honoring the wishes of the patient and the family. So I would distinguish myself by humanizing myself. I would focus on the goals and wishes of the family. Um, but I will also work behind the scenes to make sure that I honor and value the patient's and family's emotional and psychosocial needs. I find that that is really important. I find that this will help to affirm um, what life means to the patient at that point. And I also think that it's especially important to make sure that I'm doing everything to ensure that the family actually heals. So I thought that end of life care was very interesting, and learning and taking myself out of the box, that culture and diversity, it is very fluid. There is and should be a very broad definition of what that means. And as a social worker, we have to have continuous education. We have to be cognizant on what specific actions and specific decisions mean. So, are we really prepared based on the limited knowledge? One of the things that the article pointed out was, even though that cultural diversity is important in EOL care, there is still a lot of research and still a lot of future planning to be done so that we as social workers can be prepared for end of life care.